Hi everyone, Dr. Wayne Saltsman, geriatrician and elected member of the Burlington Board of Health, coming to you again this week to help you stay informed, feel supported, and be prepared during this COVID-19 pandemic. Amazingly, information continues to arise that is new and thoughtful, and a number of things that I want to talk to you about today. But first, as always, the numbers, and the numbers are becoming truly impressive. 3.8 million cases of COVID-19 in the world, with 270,000 deaths. In the United States, we have tested 8.1 million people, with 1.25 million becoming positive. Amazingly, data from 2 days ago shows that we are still having in the tens of thousands cases every day. And in the United States, more than 75,000 deaths. Here in Massachusetts, we continue to have a significant number of cases after doing 350,000 tests. And we know that there have been 4,500 deaths in Massachusetts, and 60% of them, as I commented last week, are due to long-term care facilities. So what does this all mean? It means that despite the fact that there are some places that are getting better, some places are actually getting a little bit worse. And COVID-19 is still very much a reality in our country and in our community. Case in point, when we first started talking about COVID-19, we thought that the children were in some way immune or not affected by this. And we know from recent reports that children may become significantly ill from COVID-19. Still so much to learn, so much to do. In the process of all this, as we know, there are discussions about reopening the United States. And our leaders are debating between economics and between healthcare. And I know that our state and local leaders are entertaining these debates as well. And these debates are not easy because there are arguments on both sides. So please know that the Burlington Board of Health is trying to do its part in helping our local leaders understand how to balance economics with healthcare and consider our community and our business partners at the same time. Obviously, much more information to come on that. I wanted to raise the concern about aggregate housing. Not just skilled nursing facilities and cruise ships, but prisons, assisted living facilities. Prisons now have their own dedicated CDC webpage, and the concerns regarding the thousands of individuals who have been infected, both inmates and staff, is very much a reality, and how to help that. But Burlington has 3 assisted living facilities, and we need to keep in mind that these are aggregate housing for older adults. And so we need to be very careful and not just think that we can innocently go and see people in these types of settings. Older adults are very much at risk for being contagious in these settings to COVID-19 as well. So take care. Over-the-counter medications continue to be a focus as possible cures for COVID-19, and the latest one that's come to light is vitamin D. And we've all heard about vitamin D for our bones, etc. But there are other effects of vitamin D which makes it possible that they could affect things like the coronavirus. I actually read the article that discusses this, and while we do know how vitamin D might be able to fight very, very small virus particles, the conclusion from these articles was that there's still much work to do and clinical studies to do. So please don't run out and purchase vitamin D thinking that you're protecting yourself. Like any of the other over-the-counter medicines that have been talked about, much more work needs to be done first. So please be cautious. Primary care physicians, specialists, surgeons who do elective surgery are trying to understand how to reopen themselves. I have to tell you, from a doctor point of view, the biggest part about being a doctor is having that interaction, that direct interaction with a patient that telehealth just can't bring to light. So have patience and support our healthcare providers as they're trying to understand as well how they will be able to reopen and start taking care of patients the way they are accustomed and the way our patients are accustomed as well. As always, what can we do? The message is the same, and as I've said before, the message should be a norm in our life now and moving forward. Hand washing, hand washing, hand washing. Clean surfaces that are commonly exposed. Protect your cough and your sneeze. Wear a mask. If you're ill, isolate yourself. And social distancing continues to be important. Once again, if you want to go outside, go outside. Get some fresh air, get some exercise, but be smart. Maintain distancing. And if you can't maintain distancing, as is the mandate in the state of Massachusetts, wear a mask. If you're thinking about an older adult, extend that thought and make a call. It makes all the difference. We're all in this together. Be safe and be well.